Hello there, my name's Dr. Andy Knox. I'm a GP in Morecambe Bay, based at Ashtree Surgery in Carnforth. This video is about back pain. Back pain is really common. It affects so many of us. We're often twinging things, pulling things, just getting a bit of muscle spasm, and it can cause us some really significant problems. But actually, the vast majority of times, you don't need to see your nurse practitioner or a GP. You can look after your back yourself and sort it out with the help of a pharmacist and some practical advice. So this video is going to give you that advice so you can manage your back pain and sort it out. And of course, if things aren't getting better despite these things, then of course come and see your nurse practitioner or your GP and we'll see what further help might be necessary. Sometimes just a phone call can do the trick. Now, back pain. So, there are some things that you would definitely want to come and see us about straight away. If your legs are actually giving way as a result of your back pain, or you've lost the sensation in one of your legs, then you definitely need to come and see us. Or if you lose control of your bowel or your bladder, without a doubt, book an appointment, come and see us. However, most twinges, most muscle spasm where things have just gone really tight and sore in your back, here's some practical things that will help. First of all, get some heat on there. When muscle's gone tight and in spasm and is really locking things up, heat helps it relax down. It's a hot water bottle, wrap it in a tea towel right over the area that's sore, 20 minutes, 3 or 4 times a day, just to relax the muscles down. Secondly, think about actually just go and get yourself a massage, someone who can work the area, someone just to release that tension out of the muscle. The third thing you might want to think about is some basic pain relief. Paracetamol, or if the pain's a bit more severe, Cocodamol, both of which you can buy over the counter from a pharmacist. 2 to a maximum of 4 times a day. So 2 tablets 4 times a day. Adding into that, and in between times, you could also use some ibuprofen. Fantastic, because it takes some of the inflammation, that swelling out of the muscle or the sore area. Make sure with your pharmacist that it's not going to interact with any of your other medications, or it's not going to cause problems to other underlying conditions you might have, like asthma or like high blood pressure or kidney problems. Also, you might find that ibuprofen can work in a really good gel form and you can just rub it into the area and that can really help. The fourth thing you might want to think about is some basic stretches, and I'm going to show those to you now. Okay, so here is the stretch that will really help your lower back if you've got some spasm. On the side where it's sore, bring that leg up to 90 degrees. Just take hold of the knee with the other arm and then just gently pull it across the body, trying to keep your pelvis flat into the floor. And that will allow a stretch across your lower back and your bum that will just stretch out those muscle fibers and really relieve the pain. So nice deep breaths, holding it for about 30 seconds and then relax down. Try and do 5 of those every morning before you get out of bed and every night before you go to sleep. And then make sure that you try and just keep a bit mobile. You don't want to be sitting completely still all the time with a bad back. You want to keep moving where you can. And if you follow those bits of advice, you'll find that within a few days, actually the back's feeling a lot easier on its own.